So what is called close contact? This is a very, very important terminology because this lot of people do not know who is someone vulnerable to catch the infection, has high chances when these are the following situations in which one is labeled as close contact. If you are less than 6 feet of a patient who is COVID positive. This is why I told you why the 6 feet is important. I'm sure now you must have good knowledge about that. If you are less than 6 feet or very close to somebody who is COVID positive, and somebody at that point of time, when you go and meet that person, at that time, that person coughs or sneezes, and you touch the spaces and you touch your face, and then there's a high chance that you are a close contact and you should be monitored in the coming next 3 to 5 days. Because initially, after meeting somebody who is high risk, you may be normal for 1 or 2 days. But in that 1 or 2 days, you might have spread the infection to a lot of people. Typically, people manifest the disease in 3rd day to 7th day. But if you may harbor the virus from day 1. So that is very important. And most important thing I would like everyone to pay attention to it is the duration of exposure. This is what I told you in the first slide of how COVID spreads. The longer you are exposed, the more likely you are going to get. But what is the definition of longer? The definition of longer is 15 minutes or more. Very, very important terminology. I want everyone to listen to it. 15 minutes. So it's very, very short time. So even if you are exposed to an infected person for 15 minutes or more, there is a very high chance that you can be infected. So if this number is less than 15 minutes, then you can evade the infection. But if it is more, that is why the government and the doctors have stopped asking people to go to cinema theaters or recreational activities where you spend more number of time. If you spend 2 hours, 3 hours, 4 hours in a closed space without ventilation, there is 100% chance that somebody can get infected if there is an infected person in that room, despite double masking or single masking. So the duration of exposure is the most important element in which one can get COVID. So remember this very, very carefully.